universal health coverage NHIF support program that will benefit 8,667 vulnerable families in Bomet County that is fully sponsored by the government. In this financial year, we will expand the number to cover up to 10,000 needy families that we had promised. Thus, 50,000 to 70,000 individuals will access medical cover services through this county initiative. So the 10,000 that we are talking about are the principal beneficiaries, but they also have dependents. That is why we are talking about 50,000 to 70,000 individuals who will benefit. Additionally, the national government is also offering support to 19,180 beneficiaries, in which my government helped in the identification process. And probably that explains why we have not reached a target of 10,000, because some of the people that we had identified have actually been offloaded to the national government. So, but in a very short period of time, we'll be able to cover the balance of 1,000, around 1,400. Cumulatively, we have 29,180 families out of 93,000 that will be supported by the end of this financial year. I want to assure you that the selection process was done in a fair, transparent, and participatory manner to ensure that the intended beneficiaries meet the required criteria. Further, the beneficiary list was cleaned to check out for double registration. But as requested by the members, I think we'll also make the list public. We'll share with our MCAs. It will get to the sub-ward administrators' offices so that we can also check whether we have anybody who was included in the list and is not supposed to be in that list. It could be there also people who are left out, and we'll be able to capture in the balance of 1,400 who are still yet to fill to make 10,000 beneficiaries. But I want to thank the people who are involved in the identification process. And Father Ambrose, I think we'll still partner with the church, because you are the people who normally interact with the needy. When there is an issue in the society, the first call is either to visit the house of the pastor or a father. So we will still partner with you so that we can ensure that everybody who is needy within the society is captured. The selection panel comprised of multi-sectoral committee with representation from the executive and the assembly, the county commissioner's office. We had also representative from the youth, women, and persons with disabilities. We had also some representation from faith-based organization and the National Hospital Insurance Fund, that is NHIF, which was tasked with overseeing the registration of eligible families and their dependents into the system, as well as inspecting facilities to meet the required NHIF accreditation. For our Longisa County Referral Hospital has a failed space, personnel, and ICT infrastructure to help with the biometric registration of the patients at the point of service and in the processing of claims through online platform. I don't think that's necessary. Today, we have some members of the families who will be registered biometrically, and at the same time, the function will form a basis for us to announce to all the concerned that they can now utilize NHIF to pay for their treatment. We thank the NHIF for the innovative decision to have members register when going for their treatment. This will ensure efficiency and patients will not suffer queuing in the offices. That means they can line up for registration and get services at the same time. So please, once you visit a facility and you have the card and you have been identified as a beneficiary, you can receive the service as you register. Access to quality health is a human right anchored in the Bill of Rights in the Kenyan Constitution, where it advocates that citizens are entitled to the fundamental rights to the highest attainable standards of health. Likewise, the universal health coverage agenda seeks to deliver on this right. The push for provision of comprehensive cover began way back in 1965 when the proposal to establish NHI was penned down. Set aside 60 million shillings in the financial year 2021-2022 financial year to meet the cost of health insurance under the support to the vulnerable program. So we have set aside 60 million for this program this financial year, and we have already paid for 6 months. So you can be very sure that this service will not be discontinued. Of course, we wanted to roll out, and we actually did roll out this program in the year 2019, but because of the challenges that we faced, we could not continue. In fact, the first payment that we made to NHI was in the month of July, I think, 2019, where we paid 5 million. It was supposed to be 5 million every month. For 12 months, that makes how much? 60 million. So when we paid 5 million in the month of July 2019, between July, normally in the government, between July and October, we normally have challenges with cash flow. So we had delayed disbursement from the national government, and we went into arrears. So when we went back to NHI, I think around the month of November, December, we were told that we were in arrears and we were supposed to pay 30 million to revive the program, and then pay another 30 million to ensure that the beneficiaries continue enjoying the service. He was elected, just like the president was elected. And I think it is proper that is given respect as the Deputy President of the Republic of Kenya. This was a private visit to Uganda. And I want to believe that the Deputy President was not using resources from the government. He was using his own personal resources. Our people have been encouraged to invest. Now that we are under even East African community, who knows? The Deputy President may be having his own investment in Uganda. Who knows? Because Uganda is going to be producing a lot of bananas. Maybe he's having banana plantation or maize plantation, or he's keeping some poultry in Uganda. So he should be respected as the Deputy President of the Republic of Kenya. So we are not happy the way he was mistreated. We are not happy the way it's being handled. I mean, and I want to believe it is not the president. Maybe these are people in the ministry. I don't know whether it's the Ministry of Foreign Affairs, Ministry of Internal Security. I don't want to believe that it is our president, because the Deputy President has been a very close president.